Good afternoon, everyone. Welcome to another enriching session here at eLotus. Before we start, I'd love to know, have you ever encountered a situation where a patient was taking both herbal remedies and prescription medications, and you weren't quite sure how they might interact? My name is Myra Chen, your host and moderator for today's webinar. At eLotus, we've been proud to offer top-quality CEU content for over 3 decades, bringing together a community of practitioners dedicated to lifelong learning. With more than 200 expert speakers, 700 courses, and 3,000 hours of CEU content, we're here to support your professional journey. It is my pleasure to introduce Dr. John Chen, my uncle, and also a name many of you are already familiar with. Dr. Chen is a leading authority in both Western pharmacology and Chinese herbal medicine, with a unique ability to bridge the gap between these two fields. His impressive academic career includes teaching positions at prestigious institutions like USC School of Pharmacy, Emperor's College, and Yosen University, among others. Dr. Chen is also the lead author of several seminal works, including Chinese Medical Herbology and Pharmacology and Chinese Herbal Formulas and Applications, which have become essential references in our field. Today's webinar, Herb-Drug Interaction and In-Depth Analysis, will guide us through the intricate and critical topic of how traditional herbal remedies interact with modern medications. Dr. Chen will lead us through 3 key areas: understanding the dynamics of herb-drug interactions, addressing ethical considerations in our practice, and ensuring patient safety when combining these treatments together. This course is designed not just to expand our clinical knowledge, but also to reinforce the importance of ethics and safety in patient care. He will include updated information and research up to this year, 2024. Before we get started, please remember to set your chat from host and panelists to everyone, so everyone can participate in the discussion. If you have any questions during the webinar, please use the Q&A box. And lastly, the quiz. The quiz for CEUs will be available the next business day, late afternoon, for those with qualifying attendance. Now, let's get started with today's webinar, and please join me in welcoming Dr. John Chen.
All right. Let me do a quick audio and video testing and make sure the audience can see me and also hear me. So if you can type in the chat and let our staff know whether audio and video are working, then we'll go ahead and get started. All right, good. I got 2 thumbs up. All right, welcome. Welcome to today's class on herb-drug interaction and in-depth analysis. Before I start today's class, I want to tell you 2 little stories, and I think that will set the tone for today's class. I graduated from South Belo University of Chinese Medicine in 1988, and soon after that, most of my classmates went on to start a private practice, and I went on to study pharmacy at USC School of Pharmacy. And we would get together every once in a while to share what we are going through, what are some of the pros and cons, and things that are exciting. And I remember talking to a friend of mine at that time, and he was a very good student. He was in fact the valedictorian for our class, and he was saying that one of the biggest challenges that he was facing was not so much treating patients, but specifically answering the question of drug interactions. Because back then, this is about 35 years ago or so, Chinese medicine was literally a alternative medicine. So most of the patients, when they come in, they have already gone to medical doctor, gotten a diagnosis, and take a number of drugs. So when he gets ready to prescribe herbs, then inevitably the first question that comes up is, are these herbs going to interact with the drugs? And what happened is we did not have any class on pharmacology, and we certainly did not have any information on drug interaction. So he did not want to tell the patient that there are no interaction because that potentially may be false and may end up harming the patient. But he also don't want to tell the patient that he didn't know either. So he was caught in this situation where he did not know what to tell the patient, and in the end, he said he just basically gave up on the herbs. So he became a quote unquote acupuncturist, and that's all he does. So that's quite a shame because a big part of our education in herbs is in herbs, and to throw it all away because you cannot answer one question is just such a shame. All right. So that was the original inspiration behind why I started teaching this class. So over the last 30 years or so, I've been teaching this class quite often and also update the class on a regular basis. And I also remember many years ago, I taught this class to a group of medical doctors in Riverside, California. And it was a 1-hour class. So usually I set this up as an 8-hour class, but in this case, it was a 1-hour class. And it was overlapping with dinner. So it was basically the medical doctors are working this HMO where they had a long day, so they had to make patient rounds early in the morning, usually from 6 to 8 or so. And then they go to their private practice, see their patients, do their meetings, whatever else they do. And then at the end of the day, they go to the CME class. So they are having dinner while listening to this talk on herb-drug interaction. So there I was, I was quite young at the time, of course, and I was very energetic, and I wanted to impart as much information as I can in that 1-hour time. So, and I also have a tendency to speak faster and faster when I'm nervous. So you can imagine, I'm trying to squeeze in as much as I can of the 8-hour class into 1 hour, and I'm speaking, at the speed of light. And what happened was when I finished my presentation, they turned on the light, and I noticed, half of the doctors actually just fell asleep or were not paying attention. And that's quite disappointing, because that was the very first time I spoke to a group of medical doctors, and I was hoping to make a difference, in helping them to learn and understand Chinese herbs. But it seemed like my effort completely failed. So I was quite defeated. I was quite deflated. And I was gathering up my business cards, just, getting ready to pack up and go home. Then I realized I brought a stack of business cards, and they were all gone. There were about probably 60 or 70 medical doctors in attendance, and I brought a whole stack, no less than 100. They were all gone, and I couldn't understand why. I thought maybe the cleaning people came early and just, put everything in the trash. But as it turned out, everybody in the audience pretty much grabbed one or more of the business cards. And I couldn't understand why. So if none of them were if most of them were not interested in the presentation, why did they even bother to get my business card? And then one, medical doctor came up to me, and he basically asked me, I don't know Chinese herbs, but many of my patients take Chinese herbs, and I don't know what to tell them. And then he said, is it okay if I just refer all my patients to you? So it finally dawned on me that these doctors have gone through medical school, they have certain specialty, and they are like really busy, in just their regular life as a medical doctor. They really have, in most cases, no time and no interest to learn Chinese herbs specifically. But since many of their patients take herbs and supplements, they don't know how to have a dialogue with these patients. So what they really want, not more than anything else, is just to have somebody who they can refer to, somebody they know and trust. That way, it's like a primary doctor referring the patient to a specialist, to a gastroenterologist, cardiologist, and so on and so forth. They want to have within their Rolodex of reference an herbalist that they can refer to. So basically, what it dawned on me is that, Sam, the slide is not working. Click on that once, and then here we go. What it dawned on me is that Chinese medicine and Western medicine historically have been practicing on their own side of the mountain. Chinese medicine, most of the practitioners have their private clinic, and they do, everything within their private clinic. and Western medicine, have their network of practitioners that they refer, but by and large, there is no communication, there is no collaboration between Western medicine and Chinese medicine. So I think this is one thing that we really need to work hard to change, because if we don't, the patient are the one that's caught in between. They cannot get answer from both sides. We are practicing in isolation, and in the end, that's not helpful for the patient's healthcare. So these are my experience over the last 30, 35 years or so. But what I'm noticing is that trend is starting to change. In fact, it's started to change relatively quickly, because in the last year or so, I have gotten quite a few people that express interest in learning about herb-drug interaction. And this is not just from a TCM community. This is also from the Western medicine community. So this is an example of a seminar that I was invited to a couple months ago. This is the first annual Integrated Medicine Summit. And in essence, what it is it's a medical doctor who is also a fully licensed acupuncturist starting and hosting an integrative conference. And she practiced in Northern California, basically treating oncology patients with both Chinese medicine and Western medicine. And then she invited many medical doctors and also acupuncturists to present at this conference. And I was one of the speakers. And and they were MDs and pharmacists and acupuncturists in the audience, and they were all mingling and getting to know each other. And then right after that, last month, I was invited to speak at UC San Francisco Osher Center of Integrative Health. And this is their grand rounds. And what it is it's a CEU and CME offered to the attending physicians, interns, students, and so on. And once again, herb-drug interaction was the topic they were most interested in. Because a lot of patients were taking herb supplements and drug at the same time, and most of the pharmacists and MDs really do not know how to answer such questions. So this seems to be the burning question that Western medicine wants to know: when can they and when they cannot take herb and drug at the same time. And then just a week ago, I did a similar presentation at Pacific Symposium, except in that case, I did a 1 hour in the morning and 3 hours in the afternoon. But today, I'm going to give you much more information in this 8-hour presentation. All right. And this is all happening because in the end, that is what the patient wants, and that is what the patient demands. According to World Health Organization, over 80% of the world population uses some type of complementary and alternative medicine, and that's what CAM is. So if we are here for the patient, if we want to serve the patient, this is a conversation that we must have, and this is the collaboration that we really must have between Chinese medicine and Western medicine. Okay, and like I mentioned, Western medicine is taking that first approach. Okay, not only in classes, in seminars, but also in the medical literatures. As you can see here, the topic of this article is understanding the relevance of herb-drug interaction. This is a prerequisite for integrated medicine. All right, so Western medicine, like I mentioned, is taking their first step to learn more about herbs and supplement and how they can be used together with drugs. All right, so like I mentioned, this is a bridge that we must build. This is a bridge we must cross, and that bridge is herb-drug interactions. And the reason is, of course, because if the most important thing in medicine is to first do no harm, then we must first make sure whatever herb, whatever drug the patients are taking, they do not negatively interact with each other. All right. So with that, we'll go ahead and get started with today's presentation on herb-drug interaction. Okay. Overall, there is starting to be more and more information. I remember 30, 35 years ago when I first started teaching this class, it was a lot of theories, but not a lot of actual case studies or literature or report to actually share. But in that span of time over the last 30 years, more and more things became available. Some are theoretical, some are laboratory, some are actual clinical cases. So overall, a general proposal has been made to give a classification to the interaction that are listed. And they are to be divided into 3 classifications. Class A is herbs that have no clinically relevant interactions. So basically, no known interactions. Okay, so if you talk to the patient, make sure you use these appropriate words for liability purposes. Don't tell them there are no interactions, because that's basically telling them they are perfectly safe. But what happened is herb-drug interaction is really a very early science. There is far more that we don't know than we do know. Okay, so make sure you tell them there are no known interactions or no documented interactions. So basically, to the best of our knowledge, nothing has been documented, but we cannot make that guarantee. Okay. Class B is for herbs which have clinically relevant interactions that are biologically possible. Okay, so this is interaction based on molecules and based on animal studies. Okay, and as far as we're concerned, what happened is a lot of studies are based on molecules, whether it's drug molecule or maybe one representative molecule from an herb. But what happened is that one molecule from one herb does not necessarily represent the whole herb, and certainly does not represent an herbal formula, because every herb contains at least hundreds of different molecules. An herbal formula, whether it's 4 herbs or 5 or 10 or 20, may have thousands of molecules. So you cannot take the information from one molecule and then say, well, because this molecule interact with this animal study, this drug in animal study, therefore that interaction applies to the entire herbal formula. That's stretching it a little bit too far. But what you should take away from such study is keep that in mind, pay more closer attention. If the patient is taking certain drugs that have been shown to interact with one molecule in the herb, and then see whether that becomes clinically relevant or not. Most of the time, I would say probably not, but in some cases it could be. And of course, animal models are not the same as human, because they are just not the same. So in any case, keep an eye on it, but you don't have to take immediate or dramatic actions. And then class 3 is herbs that have clinically relevant interactions that are known to occur, and then preferably in human that are actually taking the herb. So these are interactions based on herbs or formulas in human taking drugs that have narrow safety index, that have hepatotoxicity or nephrotoxicity. So basically, herb-drug interactions that are documented in humans. So this is clinically relevant information. All right. So this is what has been proposed, and it seems quite reasonable. And as more and more information become available, slowly, I think you may see in medical literature that will then, let's say if you have certain interactions, you will have a classification first, and then the description of what actually happened. That way, you can quickly have an idea how significant the interaction is, and then learn exactly what happened. All right. As far as the mechanism of interactions go, this is a pharmacology principle in which all the drugs and all the herbs have to go through these 2 pharmacology principles. One is pharmacokinetic interaction, and the other one is pharmacodynamic interaction. So pharma refers to the pharmaceutics. So this is basically describing the medicine, whether it's drug or herb or supplements. And kinetics refers to the movement. So this deals with the movement of the molecules into and out of the body. So imagine if you take something by mouth, right? It has to go to the stomach, go to the intestines. It has to first be absorbed. Then it has to be distributed to the disease part of the body. And what I mean by that is, let's say the patient is having asthma and there's bronchospasm. You want the medicine to go to the lung to dilate the lung. You don't want that medicine to go to the hands or the toes or the head, right? And then vice versa. If somebody has a heart attack where there is a constriction of the coronary artery, whatever medicine you give that person, you want it to go to the coronary artery but not the other parts of the body. So that's what distribution is. Metabolism is primarily done by the liver, and that is the metabolism to break down the drug and herbs. And then finally, elimination. Once the drug have a chance, or drug and herb have a chance to do what they are supposed to do, they have to be eliminated from the body at some point. Because once the disease is treated, you don't want these drugs or herbs to hang around in your body forever, because at that point, they're just going to cause more problems. They're just going to cause more side effects. All right, so that's the pharmacokinetics. Pharmacodynamics refers to the mechanism of action of how these medicines work. Do they work on the cardiovascular system, the respiratory system, the digestive system? Do they have agonists, antagonists? Are they stimulants or are they inhibitors? So how do they actually work in the body? And then on top of that, do they have synergy with each other? Do they have antagonism with each other? Or do they complement each other? All right. So once we learn the pharmacology of drugs and herbs based on pharmacokinetic and pharmacodynamic, then generally speaking, you should be able to predict whether some herbs and some drugs will or will not interact with each other. All right. So what I'm gonna do for the rest of the day basically is to give you a little bit more in-depth example of pharmacokinetic and pharmacodynamic theories and also specific examples. Okay, that way you have both theoretical understanding and also clinical understanding of how interactions occur and what you can do about it. All right. So the first part, absorption. Absorption interaction may occur as a result of binding in the GI tract, change of pH in the stomach, change of intestinal motility, and also change in the enzymes and normal floras. And in short, basically what happened is something in the digestive tract change, either the functions or the form or the environment, and that end up affecting the ability of the digestive system to absorb the herb and drugs. That is then considered an interaction, because if you absorb more, then the effect is going to be stronger, but similarly, the patient can have more side effects. If you absorb less, then the herb or drug may not do what it's supposed to do, and then, of course, that's an interaction. So basically, with absorption, just one or two things happen. You end up absorbing more, so the effect becomes too strong, or you absorb less, and the effect is not what it's supposed to be. All right. So binding in the GI tract, basically these type of interactions occur as a drug and the herb physically come in contact with each other. And as a result, they form an insoluble complex that cannot be absorbed, and they just end up getting flushed out of the system. So here are some examples of drugs and also later herbs that have this effect. So some of the drugs that have this strong binding effect include cholestyramine, cholesterol, ezetimibe, and also orlistat. These drugs are not prescribed that much today, but their indication is for treating obesity and also high cholesterol. And when I first learned about these drugs years ago, I just about, fainted. And the reason is because I learned basically these drugs work by taking them with meals. And the idea is these drugs will bind to the fatty and greasy part in the food. So if the patient is eating French fries, deep fried food, greasy food, oily food, and so on, that contribute to high cholesterol and obesity, then the idea is that these drugs will bind to those fatty and greasy food and flush them out of the body. So I was like, how can that be? Because if you think about it, the patient is spending time and money to buy and eat those food. They are spending time and money to buy and take these drugs. And basically, you're just flushing money down the toilet, right? Because the drug is not absorbed, herb is not absorbed. They just come out in the poop, and that's it. How can that be the solution to obesity and high cholesterol? Wouldn't eating less and exercise more be a better solution? But in the end, what happened is a lot of patients, they don't want to change their lifestyle. They don't want to change their exercise habits. They just want to take a pill that magically solve their problem. So this is a big pharma's approach to come up with that pill to magically solve their problem. But in the end, what happened is this really didn't solve the problem, and there's a big price to pay. And that big price to pay is the side effect associated with the drug. These drugs are known to cause what's called, quote unquote, involuntary projectile diarrhea, because they cause a lot of disturbance to that digestive tract, and the digestive tract also becomes very oily and greasy. So a lot of time what happens is they'll have an urge of bowel movement, and the urge comes and the bowel movement comes within a very short amount of time, and they can control it very well. So imagine if you're flying somewhere, you're in an airplane, all of a sudden this happens. I guarantee this will be the last time the patient take the drug. And that's what happens. Patients don't want to take these drugs because the side effect is just too great. All right. But assuming if you do have patients that in fact take these drugs, then one thing they do have to watch out for is the interaction between these type of binding drug and all their other medications. So this is a quote from this medical journal. Orlistat, which is one of those drugs, interfere with the absorption of many other drugs, such as warfarin, amiodarone, cyclosporin, thyroxine, as well as fast-soluble vitamins, therefore affecting their bioavailability and effectiveness. So as you can see, the binding effect of these drugs does not only affect the food, but they also affect other drugs as long as they are more fast soluble. So once again, many drugs also with fast soluble vitamins. Imagine if these patients also come to you, right? So they come to you, they have problem with obesity and high cholesterol, and you decide to prescribe an herbal formula for them. And obesity and high cholesterol in Chinese medicine, let's say, is primarily damp and flat, right? So you prescribe whatever formula. It could be Chen Tang or whatever. Then what you should also tell the patient is don't take these binding drugs at the same time as herbs, because these drugs will also likely bind to the herb, especially if the herbs are fast soluble. And if the drugs bind to the herb, they will also make the herb less effective. All right. So the solution in this case is to, number one, recognize the interaction. So recognize these drugs have binding effect. And number two, have the patient take these drugs after meals, but at least 2 hours away from any other drug, and also herbs if you prescribe herb. And if you do that, then chances are there'll be no interaction or very minimal interactions. All right. The opposite to that could also be true. We also have herbs that have binding effect as well. And that herb is actually 茶叶, which is Camellia sinensis type of tea. And that includes green tea, oolong tea, black tea, and also pu'er tea. Okay. These type of tea all came from Camellia sinensis. And the difference is that green tea is unfermented, oolong is mildly fermented, and black is fully fermented. And what Camellia sinensis tea does is it has a strong binding effect. And let me tell you a little story with tea, and hopefully you remember it well. So what happened with China is that it's a country, it's a culture with 5,000 years of history, in which there, generally speaking, have been too many people and not enough food to feed all the people. Okay, so to have a lot of food to eat, to be slightly obese is a luxury. It's not a problem. It's a sign of wealth. So historically, being slightly obese is considered a beauty. Okay, and I remember when I was a kid growing up, my mom, would always try to feed me as much food as she can. Okay, and it's always a treat that we can have a lot of meat in the meals, and generally speaking, the only time we really have that is like during the major festivals, such as Chinese New Year. So Chinese people have always wanted food that are fatty, greasy, because to them, it's the sign of good meal, is a sign of wealth. But then what happens is if you eat a meal that's, very heavy, very greasy, then what happens after meals is you tend to feel very tired. So for that reason, when you go to a Chinese restaurant, they generally serve tea along with the meal. And the idea is if you drink tea after meals, the tea will bind to the fat, to the grease in the food, in your mouth, and then flush it out of the digestive tract. So after meals, you don't feel so heavy, so greasy. And also at the same time, tea has caffeine. So it helps to, give you some stimulation so you don't have the after meal coma. Okay, so overall, that's what tea does for meals. But you can imagine if you were to take tea with Chinese herbs, or if you were to take tea with drugs, there's also a possibility that the tea will bind to the herb, the tea may bind to the drug, flush them out of the system, and then cause the other herbs and the drug to become less effective. So for that reason, even though Chinese people drink tea on regular basis, we almost never use it in herbal formulas. Okay, with probably just one exception. And that one exception is a formula called 川芎茶调散, which is cnelium powder with tea. Okay, and the reason tea is added and only at the end is because in this case, the formula is to treat primarily headache. And tea has caffeine, and they are using caffeine as a beneficial ingredient to help to treat headache. So in that case, tea is one of the ingredient. But as far as I can remember, there's no other classic formula that has tea as the ingredient. Okay, and like I mentioned, there's also a documentation of the tea interacting with drug. So in this case, it's a drug called Corgard or Naldolol. This is a beta blocker, generally used to treat hypertension, basically to block the cardiovascular system from stimulation. So the heart rate will come down and the blood pressure will come down. And what they find is that co-administration of green tea extract along with Corgard or Naldolol may reduce the Cmax by about 85%, and AUC, which is area under the curve, by about 74%. And this occurs because of the inhibition in the intestinal absorption. Okay, so basically, green tea binds to the drug and therefore block the absorption, reduce the Cmax. Cmax is the maximum concentration of the drug in the blood, and AUC is more important. AUC refers to area under the curve, which is basically the amount absorbed or the drug that is bioavailable. So basically in the blood that the body can utilize. So it's reduced by 74%. So that's quite a bit. So basically, if you were to take green tea with this drug at the same time, you can basically think of it as the drug is absorption is reduced by 74%. So that's quite significant. All right. So once again, as far as this interaction is concerned, recognize tea has binding effect. Therefore, you can take it with meal, that's perfectly fine, but don't take it with other herbal formulas and don't take it with drugs. Okay. Another interaction that also occurs as a result of binding in the digestive tract is the antibiotic, in this case, cipro or ciprofloxacin. And ciprofloxacin is one of the more powerful antibiotics. So generally, when this drug is prescribed, it's prescribed when there is a more serious infection or a more infection that is more resistant to the antibiotic that are not as potent. So in other words, if this drug is prescribed is for a serious infection, you want the drug to be absorbed, you want it to act like it's normally supposed to, so you can treat the infection. And there's one interaction that's quite common with this drug, and that is a cipro and mineral interaction. And what it is ciprofloxacin is known to bind to the minerals such as aluminum, calcium, zinc, iron, and so on. And once they bind together, they are flushed out of the body, and cipro is not absorbed in normal fashion and probably won't be able to treat infection with a lower concentration. So generally speaking, cipro should be taken about 2 hours away from meals to make sure it's properly absorbed. So now you can appreciate, or at least foresee, that Chinese herbs are natural plants. So chances are there will be some that contain these minerals. So I'm sure there are some herbs that contain, or food that contain calcium, zinc, and iron, right? So that's for sure. And what they found out is there are at least 2 that tend to have more of these minerals that may bind to ciprofloxacin and therefore reduce the absorption and also reduce the effect. One example is an herb called 小茴香, which is known as fructus funiculi or commonly known as fennel seed. This is a herb that is also used as food. As an herb, it disperses cold, warm the liver and kidney, release pain. And then the main type of pain it primarily treats is the hernia or testicular type of pain. And as an herb, this herb has a somewhat strong flavor, and it's generally used to neutralize strong flavor that may be in the food, especially lamb. So if you go to the northern China, they eat a lot of shish kebab. Shish kebab made primarily from lamb. And what they generally do is spray some fennel seed on the shish kebab to help to neutralize the strong flavor and taste in the lamb. Okay, so this is two of the main circumstances that people may consume fennel seed. Okay, and what has been documented is that if fennel seed or xiaohuixiang is taken at the same time as ciprofloxacin, the Cmax, basically the maximum concentration, may be reduced by 83%, and area under the curve, which is the bioavailability of the drug, may be reduced by 48%, and urinary recovery by 43%. Urinary recovery, the significance is that whatever drug that's absorbed into the blood eventually will have to be eliminated, and most of the elimination is through the kidney, through the urine. Okay, so overall, think of it as if xiaohuixiang and cipro were taken at the same time, the concentration that's available to be absorbed and to treat the infection is reduced by roughly about 50%. Okay, so that's once again a significant herb-drug interaction. Okay, another herb that contains a lot of mineral that may bind to ciprofloxacin is diyu, sangui sorba. This is an herb that's primarily used to cool the blood and stop bleeding. Okay, so in general cases, you're probably not going to see it used except for patients that have bleeding problems. And even for patients that have bleeding problems, generally speaking, you're only going to use it for a short period of time. Okay, so maybe one scenario you can foresee diyu, sanguisoba used at the same time as ciprofloxacin is maybe patients that have external injuries. So they are bleeding for a prolonged period of time, and they also have risk of infection. So under that scenario, you can see that cipro and diyu may be used at the same time. But if they are going to be used at the same time, make sure they are taken about 2 hours apart. And the reason is because, once again, diyu contains a lot of minerals, and it may bind to ciprofloxacin and decrease the Cmax by up to 94%. And area under the curve, once again, the bioavailability by 78%, and urinary recovery by 79%. Okay, so overall, the concentration, the molecule of cipro is reduced by about 80% or so. So basically, that means cipro is probably not going to be effective at all. So once again, recognize diyu contains mineral, it binds to cipro. Therefore, it's okay to prescribe both of these at the same time, but make sure the patient don't take them at the same time. As long as you separate taking them by 2 hours, they should not come in contact with each other, and they should not affect the absorption of each other's. Okay. The next possible interaction is stomach pH. Basically, stomach pH refers to the stomach acidity. So stomach acid plays many different roles. One is to help to kill the bacteria or the microorganism that may be present in the food. And the other is to break down the food, break down the herb, break down the drugs, turn them into smaller pieces, smaller molecules, so it can be absorbed in the intestines. And then what happened is today, a lot of people have ulcer problems. They have stomach ulcer, duodenal ulcer, they have upset stomach, they have heartburn, they have all these digestive issues. And as a result, they take a lot of drugs that neutralize or stop the production of the stomach acid. And when they do that, what happens is the stomach is no longer in its normal environment. So they may not be able to break down the food, the herb, the drug in a similar pattern or reliable pattern. And therefore, absorption may be affected. So some of the drugs that are commonly used to treat hyperacidity include antacid, which are Maalox, Mylanta, Tums type of drugs, include histamine 2 receptor antagonists. So these are generally just called anti-ulcer drugs. And then they include cimetidine, famotidine, and ranitidine. And the more common trade names are Tagamet, Pepcid, Zantac, and so on. And then the strongest out of the three category is the proton pump inhibitors. So you have omeprazole, esomeprazole, and so on, Prilosec, Nexium, Protonix, and these are the strongest out of the three. So if the patient take these type of drugs, keep in mind that these drugs will reduce the acidity, reduce stomach acid. Therefore, other drugs may be affected. Food digestion may be affected, and herbs may also be affected. Okay, and the affected means you may end up absorbing a little bit less. So if you prescribe herb at the same time and they take these drugs, the herb may be absorbed less and they may not work as well. Okay, the opposite could also be true. There are a lot of herbs that we use to clear the stomach heat. So in this case, the stomach heat can refer to the disease condition, which is hyperacidity or acid reflux. Or it could just refer to stomach acid or too much of the stomach acid. So you have too much of the stomach acid that causes stomach heat, then we use herbs that clear stomach heat. One example is Haipiao, which is Endoconca sepiae, and the other is Huanglian Rhizoma coptitis. So Endoconca sepiae is basically the transparent bone that's in the squid. Okay, so most of the time, if you just eat food, you may not realize. So if you go to an Italian restaurant and you order calamari, basically you just get the outside ring and that's the meat. But if you actually buy the entire squid and you cut it open, you'll see there's a transparent bone in the middle. So that's generally thrown out. But that bone basically contains a large amount of calcium carbonate, and that works very well to neutralize the stomach acid. So in essence, what Haipiao is the bone that contains a large amount of calcium carbonate that neutralizes stomach acid. But in TCM terminology, we call this to neutralize the stomach heat or to clear the stomach heat. So basically, you were describing the same thing, but in slightly different terminology. Okay, and a stronger herb that clears stomach heat, one example is Huanglian Rhizoma coptitis, or simply referred to as coptis. So Huanglian is also described to clear stomach heat or stomach fire. And in this case, the pharmacology is that this herb has the effect to inhibit the secretion of gastric acid. It also prevents the ulcer formation induced by aspirin, stress, and also alcohol, and has antibiotic effect to treat H. pylori. So basically, it doesn't just treat the symptom, which is the hyperacidity or too much stomach acid, but it also helps to treat the cause, which is H. pylori infection that causes stomach ulcer, or it helps to treat the complication, which is too much stomach acid that then cause ulceration. And the cause may be aspirin, which is a drug, maybe stress, anxiety, or maybe alcohol. So basically, coptis is an herb that has great effect to clear stomach heat, and it has many applications, basically to treat the infection, to treat the hyperacidity, and also to treat the damage caused by aspirin, stress, alcohol, and so on. Okay, and the effect in this case, if you compare to Haipiao, which is the squid bone, the effect of Huanglian is much stronger. It also lasts a lot longer. Okay, and once again, similarly, if you have these herbs that reduce the amount of stomach acid available, it's possible that they can affect the absorption of the herbs. Okay, so maybe the absorption will go down by 5%, 10%, generally speaking, a small amount. If the patient is taking other drug, well, then try to have them take it, some hour apart, maybe half an hour, 1 hour, 2 hours, or so on. That way, herbs will be absorbed and do what they are supposed to do. Drugs will be absorbed and also do what they are supposed to do. So both can coexist peacefully and do what they are supposed to do. Okay, the next possible interaction is caused by intestinal motility. Okay, so in this case, what happened is the breakdown of food, drug, and herb occurs in the stomach, but the absorption occurs in the intestine. Okay, and intestine has this intestinal motility, basically slowly push down the content from small intestine to large intestine to colon and eventually out of the body in bowel movement. So if the intestinal motility is affected, where if it pushes too fast and everything is flushed out too fast, then you're likely going to absorb a little bit less. So one reason why the intestinal motility may go up faster is if the patient is taking laxatives. All right, so these are drugs for treating constipation. One example will be milk of magnesia, and the other example is Senecot. Milk of magnesia is basically what's called a osmotic laxative. So what it is it draws fluid from the body into the intestine, increases the pressure, and then pushes everything out. Okay, this is most effective if constipation is characterized by a lot of dryness. So one example would be, let's say the patient takes opioid medication, opioid drugs. Opioids are notorious for causing dehydration. So patients that take pain medications, whether it's Vicodin or Tylenol or codeine, they usually have a very dry mouth, okay, and also dry intestines. So dry mouth, they'll drink water, dry intestine may cause a lot of constipation. So opioid-induced constipation generally responds well to milk of magnesia. Another type of laxative is called Senecot. Senecot is what's called a stimulant laxative. So what it is if the intestinal motility is slow, then what happens is you need to stimulate the intestines to begin to regain its normal motility. And one type of drug that causes a lot of slow motility is the antipsychotics that are generally prescribed to patients that have schizophrenia, emotional disorders, and so on. So if they have constipation due to slow motility, then stimulant laxatives like Senecot would be a good counter for that problem. So in both of these cases, if the dose is just right, then the patient should be fine. If the dose is too high to a point where they cause diarrhea, then there's a good chance that if they take herb at the same time or other drug at the same time, they will be flushed out of the system too fast and therefore not be absorbed properly and not do what they are supposed to do. Okay. Obviously, there are also a lot of herbs that we call drain downwards. So basically, this is to drain the content in the intestine downwards, in part to treat constipation and in part to facilitate normal bowel movement. Okay, so examples include 大黄 rhubarb, 芒硝 nitrium sulfus, or commonly known as myribolidum, and also 番泻叶 Folium senna. So 大黄, basically, like we described, is an herb that drains downwards. It contains a lot of enteroid-containing compounds. And basically what it does is it has a very strong stimulant effect. Or you can even describe it as irritating effect. So what it is it's very irritating to the intestines, so much to a point where the intestinal peristalsis greatly speed up in order to speed up and push the irritant out of the intestines. So it's trying to push the rhubarb out of the intestines and at the same time basically treats the constipation. So that's basically how 大黄 works. Okay, it works twice. The first time is as you take the herb and while it's in the intestines, it will start to have some effect. And the second time that it works is the herb is also absorbed. And once it's absorbed, it will go from the intestine to the liver and then back to the blood and back to the intestines to, again, stimulate intestinal peristalsis. So this herb has an immediate onset of action and also delayed onset of action, and overall will last somewhere between 6 to 8 to 12 hours. Okay, 番泻叶 is basically the same way. And in fact, 番泻叶 is senna, basically where the drug Senecot comes from. Okay, so once again, 番泻叶 Folium senna has a very strong stimulant type of effect to stimulate and increase the intestinal peristalsis, to treat constipation and flush everything out of the intestinal tract. And then the last one is 芒硝 nitrium sulfus. And this is basically a mineral that has a lot of magnesium. So once again, just like the milk of magnesium, this herb is an osmotic laxative. So once again, if the patient has constipation or absence of bowel movement because of dryness, then this herb will be perfect because once again, it draws the fluid from the body into the intestines, increases the pressure and help to flush everything out. And then in the end, what happened is it's most effective if you combine both methods together. You combine herbs that have some stimulant effect and herbs that increase the osmotic pressure. And together they have much better synergy and much more effective to treat constipation. And my analogy of this is like flushing the toilet, right? So what happens when you actually flush the toilet? You have, number one, waters that go from the tank into the toilet bowl, and you at bottom of the toilet bowl that opens up, you have gravity that pulls it downwards, right? So think of gravity is the intestinal peristalsis. Think of the water is the osmotic. So basically, when the two are combined together, it flushes everything down very quickly and very effectively, right? So if you think of your intestines and you think about flushing them out, once again, you want to have something that push and pull and also have increase in fluids. And that's why generally, if you look at any of most of the formulas in Chinese herbal medicine, it contains a stimulant, mostly da huang, rhubarb, and it also contains mangxiao, nitrium sulfur, because they just work very well together. And once again, the patient that take any herbs or formula that drain downwards, ideally keep an eye also on the drugs. And what I mean by that is if the patient end up with diarrhea and they flush everything out so fast, there is also a possibility that they are going to absorb less of other herbs and less of other drug as well. So in this case, the solution is prescribe the herb at the right dosage for the right amount of time. So basically, you relieve the constipation, but not to a point where it causes diarrhea. And once the constipation is alleviated, then you can reduce the dose or perhaps even discontinue the formula. That way, they don't end up with diarrhea, they don't end up with dehydration, electrolyte imbalance, or reduce absorption of the other herbs or drugs. Okay, and then finally, change of enzymes or normal flora. So if this is somehow affected, then once again, the body would not be able to absorb other herb or drug in the same fashion. So what are some of the drugs that might cause a change in the digestive enzymes, and also normal flora in the digestive tract? This includes antibiotics. And what happens with antibiotic is the stronger they are, the more wide spectrum they are, the more likely they will kill the harmful bacteria and also the healthy bacteria. And therefore, then it's going to cause what's called a secondary or super infection. So basically, once everything is wiped out, the harmful bacteria grow back so much faster, and that creates the secondary problem. Okay? NSAIDs, non-steroidal anti-inflammatory drugs. These drugs cause problem by literally damaging the interior lining of the stomach. Okay, proton pump inhibitors. These drugs are very strong to inhibit the production of the stomach acid. And once the stomach acid is affected, then it's no longer able to kill the microorganism that might be present in the food. So the patient has higher risk of having an infection in the digestive tract. So also keep an eye on that. And then finally, if the patient is on chemotherapy drugs, and once again, chemotherapy are very harmful to the digestive tract system. Most people end up with chemotherapy-induced nausea and vomiting, and they are just not able to absorb food in normal fashions. We'll talk about cancer and chemotherapy more in the second half of today's class. So overall, if you have patients that take any of these type of drugs, keep in mind that they may not be able to absorb other drugs and food in the same fashion. So in those cases, what we want to do is make sure they take some type of probiotics if their normal flora is affected. They can take supplements. They can also take natural probiotics in the food. That includes yogurt, sauerkraut, kombucha, kimchi, pickle, miso, and so on and so forth. All right. There are a lot of Chinese herbs that contain a lot of digestive enzymes. So if the patient often have indigestion, if they eat too much food, during Thanksgiving, which is coming up, Christmas, or they go to buffet and end up eating too much food, then these are the herbs that have a lot of digestive enzyme that will help to improve digestion. One example is sanza, fructus crataegus, also known as hawthorn berries. Another herb is senqu, Masa fermentata, and this is actually not one herb, but it's rather a mixture of many herbs, many ingredients. I think probably somewhere around 15 or 20 that are mixed and fermented and have a lot of digestive enzymes. Another herb is called hongqu, and this is basically the red rice yeast. So it's the rice that's fermented and has a great effect to help with digestion. Then maya, fructose hode, and this is a sprouted wheat. And then formula such as 保和丸, known as preserved harmony pill. So you can either use individual herbs or you can take the formula as is, 保和丸. But keep in mind that, and this is a separate issue, but could be important, if the patient has wheat allergy or gluten intolerance, then you want to make sure you don't give them some of these herbs that contain wheat, including senqu. So senqu doesn't say that it's wheat, but it does contain some wheat. 麦芽, okay, and also 保和丸. 保和丸 contains senqu. So once again, if the patient has wheat allergy or cannot take gluten, don't give them senqu, 麦芽, and 保和丸. Okay, and there are also some herbs that help to protect the digestive tract. So in this case, this formula protects the digestive form. And what I mean by that is it protects the organ, it protects the anatomy, it protects the structure, or specifically the mucous lining of the stomach and intestines. So this is a formula called 左金丸 left middle pill, and this historically is used to treat stomach heat and stomach fire. And basically what it is it has a protective effect against aspirin-induced damage to the stomach mucous linings. Okay, so basically aspirin is one of the NSAIDs. It's a little bit different, but for this class purpose, think of it as NSAIDs. And NSAIDs are notorious for causing stomach ulcer, causing damage to the lining in the stomach and duodenum. So what happened is this is a formula that helps to protect the digestive tract linings. So if they have to take aspirin or NSAIDs for some reason and they need to continue taking it, use of this formula is at least able to have a counter effect to protect the stomach while the patient continues to take the drug. Okay, so this deals with the form. And then if the patient has problem with the function, so basically they have fatigue, they have poor absorption, they have no appetite. So while the digestive function, the digestive organ itself may be fine, it's not able to properly perform the function. So to improve the function, we need to use herb that tonify the qi, right? Qi corresponds with function of the organs. So these are the formulas that tonify the spleen and stomach qi to improve the digestive functions. So you can use 四君子汤 4 gentlemen's decoction, 6君子汤 6 gentlemen's decoction, and also 森林白术散, ginseng, poria, and attractor lotus powder. And this is important because if you remember, there is a classic school of thought in Chinese medicine called 脾胃论, which translates to the school of spleen and stomach. And what happened is this school was developed because at one point in time in Chinese history, there is a government formulary in which many of the herbs in the formulary were very strong, very harsh, very powerful. And when this formulary was given to many of the provinces in China, and a lot of doctors use herbs in this formulary, what happened is these bitter, cold, strong, harsh formulas cause a lot of digestive issues, cause a lot of damage to the spleen and stomach. And also patients that have chronic illness tend to also have a lot of spleen and stomach deficiency. And what they found is that when you have patients that have these chronic problems, if you go straight to treat the chronic problems, whether it's heart problem or lung problem or kidney problem or whatever it may be, it doesn't work very well. And the reason is because even if you have the perfect diagnosis and the perfect formula, the digestive organs are so weak that they are not able to absorb the herb, and therefore the herbs don't work. So what you need to do is you need to restore the digestive function first. You need to make sure the patient eat a bland, gentle food. So in Chinese medicine, that will be just plain porridge. In Western culture, that's probably going to be, the more bland chicken noodle soup. But basically, something that's bland and simple and easy to digest. and at the same time use herbs that help to gently strengthen and improve the digestive function. And once the digestive function improves, then you can switch to the formula that treat the underlying chronic long-term problems. And at that point, the digestive function is strong enough to actually be able to absorb those other herbs, and then the patient will get better. Okay, and then today we also see a lot of that. And these are the patients that may have chronic inflammatory disease, that may have chronic illness. Maybe these are the patients that are going through chemotherapy and radiation. So they have a lot of, let's say, suppressed red blood cells, suppressed white blood cell, bone marrow suppression. So their problem is very deep in the body. Maybe they have, severe kidney deficiency. But at the same time, they are very weak, they are very deficient, and their digestive tract is completely messed up. So in that case, what happens is if you prescribe herb to tonify the kidney to help them to generate more red blood cells and white blood cells and bone marrow cell, what happens is it may not work because those tonic herbs are, generally speaking, very cloying, very hard to digest. And if their digestion is already damaged, they are not going to be able to absorb those herbs. So what you need to do in those cases is, once again, you need to start out with a very bland diet. You need to gently improve their digestive functions. And that's why you use these type of 四君子汤 or 六君子汤 or 参苓白术散 formula. You need to treat their digestive function first. And once that's improved, once that's more normal, then you can then gradually switch to a stronger tonic formula and then perhaps start out with lower dose. Okay, so it's very important to keep in mind that for there is drug or herb that cause weakened digestive state, you need to consider treating that first before you treat everything else. All right, so overall absorption type of interaction, as you can see, is not that easy, not that difficult to understand. You have binding in the GI tract, change of pH, change of intestinal motility, and also change of the enzymes and normal floras. So if you have something like this, and let's say if you didn't know before, and somehow the patient ended up taking drug and herb at the same time, interaction may still occur, but generally speaking, it's common, but not serious, not significant. Absorption in most cases, and this is just my guesstimate, is probably no more than 5 or 10% up or down. Okay, so theoretically, interaction occur. Clinically, they may also occur, but not to a point in most cases where they become clinically significant. All right, so if for those of you who are listening to this listening to this class for the first time and didn't know this, you have gone through many years of practice and you probably don't even know this. So this is something that, like I mentioned in many classes, that is most likely to occur type of interaction, and that's the absorption type of interaction. But generally speaking, not clinically relevant in most cases. But now that you recognize it, one of the easiest way to prevent it is to simply ask the patient to take the drug and herbs separated by about 2 hours. And if you do that, you can prevent or at least minimize the absorption type of interactions. All right, so let's take a 10 minutes break, and then we'll come back and continue with the next part.
All right, we'll resume class at 9:15 a.m. Pacific time.